Friends, it's Rebecca, and in this brief video, I want to show you how to find the community transmission rate of COVID in your county. The CDC tracks this information. It is an undercount, and the CDC knows that. It is an undercount because it does not include rapid tests taken at home, which is how many people find out that they have COVID. So unless you report that, or you get that confirmed with the doctor's office, if you're taking that test at home, it wouldn't be counted here. So it is an undercount, but it's still a really important piece of information. So if you are a person who wants to do a risk assessment, and figure out what kind of risks you're taking when you go out in public, this number is really important because it tells you what percent of people in your community have COVID. It's a measure of how much COVID is out there. So that might change your mind or shape your decisions about how you where you go, how crowded places are, whether you wear a mask. As a reminder, the CDC does recommend masking right now across the U.S. and in all high counties with high transmission levels. So how do you find this information? You can put right in your search bar, CDC's COVID data tracker. Click on that, and you can scroll down because the top information is about the U.S. We want to look at this up county by county. Let's look up Douglas County, Kansas, home of KU. And here we scroll down, we're going to start to see our data emerge. This number, the COVID-19 community level, the CDC really stresses, you can see it's up front, it's in larger font, it is also not the information you're looking for. This is a combination of case rate per 100,000 and hospitalization, new hospital admits for COVID, and percent of staffed beds with COVID patients in them. So they take those three things and they combine them together to tell us, that to come up with something called the community level. That is a new metric. It has not been around. It doesn't really have a historic place in medicine. And it will always, I mean, mathematically, I guess it's not always the case, but in effect, it always undercounts or misrepresents the actual risk that people are taking, because you care if your hospitals are full, and if your hospitals are full, you definitely don't want to get COVID, but you don't want to get COVID even if your hospitals are empty, right? So that's what you're interested in. So that's why we don't pay attention to that number up there. The number we care about is right here, case rate per 100,000 population. Any number over 100 is considered high, and so that number is high if it's over 100. Most of the U.S. is high or substantial right now, in the upper 90% of our population, and most of our counties are high right now and have been for months and months and months. Sometimes this number gets in the 200, 300, and 400s, so far, far above high. Low is considered under 10 or under. So 10 or under is considered low. So that is the number you probably care about, because that tells you when I go out in public and I'm mingling out in public, I'm at the grocery store, my kids are going to school, how much COVID is out in my community. That is what you got right there. We can map that by changing the default to the map is COVID-19 community levels. We want to change that to community transmission. Community transmission is slightly different than the case rate. It's a combination of case rate plus the percent of people who are testing positive, but it's the closest way we have of I think of mapping this number. And so here's Douglas County. You can see it's coming in as high. And so you can see across Kansas, most places are dark red or pink, and that means most cases are high or substantial. Fits with the rest of the country. If you'd like help finding your county's information or other information about COVID, please let me know.